Yes. We leave it at that. Thank you. We want to also move on, and of course, the next cartoon is about Munene Nyaga, and this is the visit that we had with President Uhuru Kenyatta in Cuba, and right now we know that they are to import 100 doctors into the country, and we can see them. This is what he's actually captured. Any strategy for curing this cancer? And we can see the cancer is of corruption and the debt that we saddled with as a country. So will the Cuban doctors help us lance this boil of corruption and debt? But more importantly, Dr. Eseli, is this the way to go? To import the Cuban doctors into the country?
It's tragic that at this age of our country, we have never really handled our healthcare properly. Right from the human resource to equipping our hospitals to training, we've actually been a failure. So what I would have liked us to do was perhaps copy the Cuban way of training the doctors rather than importing the doctors. You see, it's like what the old adage about giving you a fish or teaching you how to fish. So what we should be doing, because we have unemployed doctors in this country.
Yes.
And one thing I find very strange is that people who work 8 hours a day are paid far more than these doctors who work 48 hours.
No, they can't.
So I think we've mishandled our healthcare systems in this country. Importing doctors is not the solution. Retired President Moi imported doctors from Egypt. It did not make any difference. Apart from them coming here and having to be retaught English and having to have a translator with them who can translate into Swahili whatever is being said, it's not the solution. At this age of this country, if we are talking about being a lower middle income country, I think it's a shame that we must import doctors.
All right.
Yet we can train them. What I would have expected them to get from Cuba is that, okay, the Cuban health system is run like this. Can we copy that and run our health system like Cuba? Because you bring those Cuban doctors here in a system that's not running like Cuba, they will not be able to work. You take them to a hospital where there are no facilities, they will not be able to work. So it's I think we are handling it in an upside down way of doing
Dr.
things.
Ochede, very briefly on it.
Yeah,
just
I think this is an artificial solution for a deep-rooted problem, and it is unnecessary, it is irrelevant, and it's misplaced. First, we have many doctors who are unemployed, as Dr. Celia said. So it's not like we have a shortage. In fact, the problem is that there are many doctors who qualified and do not have employment. Why bring 100 and we probably have like over 1,000 doctors who are unemployed? Two, the question we've been having in this problem is the problem of paying doctors. They even keep going on strike. So the money that we want to give some 100 Cuban doctors, why are we not distributing it? Thirdly, what is their specialization? No one has demonstrated what the specialization of these 100 doctors are. In fact, most times people go out of this country for specialized attention. I've not had anybody go to Cuba. Sometimes they go to India, South Africa, in the Western countries, not Cuba. So what is that specialization? But more importantly and lastly, you must remember that although health is a shared function under the Constitution, the government decided to devolve it. So in practice, health is a devolved function. If it's a devolved function, then what business does national government have bringing doctors? And yet doctors are actually now supposed to work within the context of counties. And we know that the problem right now is even most counties are challenged, so doctors are actually leaving public service to go to private practice. The solution does not lie in bringing these doctors. The solution is re-examining the question of health internally.
All right, Dr. Kagwe.
Thank you. I think that there are varied points being made by my colleagues, but I think it is not either or. It is not either bringing in the Cuban doctors or training our own doctors. I think that what we are addressing here are two things. First is to meet a shortfall. I actually do not believe that we have enough doctors in this country. We don't. That's number one. So we need to train a lot more doctors than we have at the moment. Number two is the question of benchmarking. Because one of the reasons why you find so many Kenyans traveling overseas, if you go to India, hospitals like Medanta in India are jammed with Kenyans. If you go to South Africa, there are so many Kenyans in South Africa, and each of them are spending huge quantities of money. We are doing harambes every day for patients who are deciding to go to India for a number of reasons. Number one is equipment. Number two is diagnostic issues. You know, and we have a doctor here because it's good for me to speak when there is one. So that if I say something wrong, he can correct it. Because one of the things that, one of the challenges that we have is a diminishing level of quality. A diminishing level of quality, perhaps because of the diminishing level of our education standards. So I think it is necessary at some point in any institution for an infusion of new people, whether it is in medicine, whether it is in education, whether even in management. Even in management, when you work for multinational corporations, whether in America or wherever, they occasionally infuse people from the outside in order to raise the standards and benchmark on a higher level than you have normally been doing. And Cuba is known globally as one of the countries that have been extremely successful in as far as the healthcare issues are concerned. Now, I agree that perhaps these people who are coming to Kenya must be looked at in terms of the specialization and where they are going to fill, the gap that they are going to fill. Because if they come as GPs, then they will not help anybody. But if they come as specialized people, backed by specialized equipment, and save us the travel to India and elsewhere, then they will have served a very big purpose, you know, for us. And I think that even when you look at other sectors of our economy, and we were sharing earlier with Jacomi about, for example, the quality of our education in terms of English. If you ask me today, and I know that the TSC would totally refuse, and they would say we have been independent for 50 years, we don't need teachers from the outside. We need English teachers in our teaching colleges. Because the quality of our English, and every employee of Kenya will tell you, the quality of English in our country, even from university graduates, is worse than you can ever believe. These people can't even write. And if you go and say that, people will bring up nationalism and say that we should not have any English teachers here. Yet we should have them. So for me, every so often we need to swallow our pride, infuse quality, infuse different thinking, look at how other people are doing it, and consequently improve ourselves. They're not going to be here forever and ever. Hopefully by the time we close the gap, we will succeed and we will have gotten something from the Cubans. You know, there's an African saying that visitors bring something. When they come to visit, they always come with something. These people are visitors. They will bring something to our medical care. They will not take away something. They will bring something. So, and we don't know the details of the deal. We don't know whether it is the Kenya government that is paying them, whether it is the Cuban government that is paying them. We don't know whether I believe there is indeed a reciprocity in the arrangement, whereas there are some Kenyan doctors who are also supposed to go to Cuba and work with Cuban doctors so that we can raise our standards. And that's key. If we want Kenya to be a health tourism destination, and that's one of the key pillars that we should have, Kenya should be a place where people from Rwanda, people from Mauritania, people from the islands, people from Zambia, it should be a place where people come to for medical care.
Thank you.
If that is going to happen, we must expose ourselves internationally to international practice and international standards.
All right, Jacoyo.
Well, I've been to Cuba. How I wish we could bring 1,000 doctors from Cuba, because Kenyans are dying. I saw the other day there are 15,000 Kenyans in India.
And 13 MPs, of course, we saw also...
yesterday, there was somebody, so I read in the paper, somebody stuck in India because they can't pay a bill for 75 million, something. Or something is wrong. I agree with Senator Kagwe. It all begins with education policy. The reason why I had said earlier today is that we need policemen from Commonwealth to come and civilize our policemen. It's the same reason we need Cuban doctors. I've been to Cuba, a country of 11 million people and 46,000 doctors. A country that does not import single medicine. They manufacture their own medicine and it is free. So it is not a question of the money we are going to pay these people. If there's anything bilateral, we actually need outsiders to come and help us fix this failed medical system. It is not working for Kenyans. Debarl was in my village the other day. the month of February alone in my sub-location, my chief was telling me he issued 10 burial certificates. 10. You know, just a small sub-location. Something is wrong. I mean, if you multiply by 42 sub-locations in game, that is 400 game people dying a month. It doesn't make sense. Something must happen. The last budget before devolution, we gave KEMSA 4.3 billion shillings. Last year, the governors used 130 billion shillings, and there is no medicine in hospital. You know, this is not a small argument. Something must happen. And the government, for even looking for doctors where it is working, they are at least attempting something. Let us create a debate that will save us. There's nothing to protect. These people are letting Kenyans die in this hospital. You can go, first of all, before, let me give you an example of Siaya County. We had 13 doctors before devolution. Siaya hospital has no doctor. They have all now treatment of Kenyans has become a trade. And the ones who are working have clinics where the medicine being bought finds its way, and Kenyans can't afford it. We must do something. How I wish the debate is not either or. We must find a solution. In education, we must find a solution in health. We must do something about our country. Nothing is working for our people.
All right, let's hear from Watangi.
Yes, Debarl, to my mind, the question that I would be answering to is our healthcare sector a troubled one? And my answer would be in the affirmative, yes. I mean, for a long, long time, because remember from the very short history of when we had the doctors' flight to better paying countries like Botswana, we had so many doctors living in this country, followed by the doctors' strike, where they joined the nurses and almost brought the entire health sector to its knees. And so you would want to ask yourself, would we be saying that are our doctors demoralized? And I would say they are, if you ask me. Because from all this history, that tells you, and it is also evident that it can be seen, for example, remember the case that we had the other day of doctors operating a head surgery on the wrong patient. Now, what does that tell you about the aptitude of those doctors? It tells you that you know, they're not sitting in their best place right now. And because when you see those kind of failures in processes, it tells you that people don't have their mind on it. And that's why I bring in the question of demoralization. So the question I would also be asking myself is, on this case, especially directly related to your question on the transfer and of technology, and by bringing in these doctors from Cuba, is that a bad thing? We would have to compare this. Is it worse than sending all those thousands of our own people to India? And I would say, I would answer in the latter, that we would rather have those. If you look into the newspaper today, Debarl, somewhere inside there is my photograph over the weekend. I was in Kejabe, and I attended church there. I had an opportunity to tour the Kejabe. Send them out. So if we want to succeed in ensuring that we can deal with the healthcare problem that we have in this country, we have to model around that kind of concept, whereby we have our own people trained by experts from outside there. Of course, we also have very good doctors. You know, Dr. Eseli, I don't mean to disparage your profession. We have very good doctors, but we need to do a lot much more. Sometimes I had spoken to the governor for Machakos. I had paid a visit there officially. And one of the areas he had been intending at that time to capitalize on was on medical tourism. And in his concept, where you remember where it was really drummed up that he was building a city in Machakos, part of that city he had modeled around doing or hosting several doctors from outside, you know, India and these other kind of places. Just the concept itself that there is the realization that we spend a lot of money by Kenyans. And ask yourself, Debarl, as a finalist, if you look at our hospitals around the country, ask yourself, where can a Kenyan now, other than the little work that was done by the Jubilee government to send equipment to some hospitals, and not enough even now. I mean, how many Kenyans can walk to hospital and get dialysis? Ask yourself, at this time when it is a clear fact of statistics that cancer kills more people than HIV/AIDS now, ask yourself, how many Kenyans can be able to access that you know, medication, and at what cost? I have a friend who was calling me the other day, a very good friend of mine. I'll not disclose his name, but somebody who is fairly well off, and he's a Kenyan, but of British descent, and his wife, and God help her, suffers from cancer. She was diagnosed with cancer, and you know, he told me that they went to the UK to take his wife for medication. But it became so expensive, so they have to come and make do with our local treatment here. But it's still tough, and you still see there's some peaks in the level of expertise. So what I'm saying is this: that any move, any gesture, any initiative that suggests or is aimed at bringing or making better the circumstances, because if you ask Jacob Mediwo, Mutahi Kagui, Otiende Amolo Eseli, when they get sick, and this is part of the judgment that we would have to pass on ourselves as Kenyans, when everybody who has either the wherewithal or the money gets sick, they go for treatment outside. That's why you hear so-and-so was in hospital in South Africa, in Germany, in the other places. Right. What about the Kenyan, right down at the bottom of the pyramid, who cannot afford even to go and pay for dialysis? Right. What about them?
I need to get this very clear. I said, what we should be doing, we should be looking at the Cuban model of health services and try and copy that and use that as a country, including the training and all that. That's why I said, do you want to be given a fish, or do you want to be shown how to fish? That's what we need to do with our healthcare service. So, like the issue of having fresh blood, infusing new ideas, the Kenyan doctors are training in Kenya, abroad, and everywhere. So that infusion is constantly there. The problem that we have is the management of the health services, and we need to rethink, was the devolution of health services model the correct way to go? That's what we need to rethink very seriously for the sake of the lives of our people. Equipping a hospital and you don't have the personnel doesn't help, because let's face it, the counties have mishandled the health personnel. So many of them don't want even to work there. The few counties where the health personnel have been treated very well, you find everybody wants to go and work there. They have got no shortage of personnel. But where they have been mishandled, they don't want to go. So we have a big problem with health services. I don't think 100 Cuban doctors will solve the problem. Right. The problem we need to solve here is our training, our model. Is it correct? Okay. So I would rather you took people from the Ministry of Health to go to Cuba and study the Cuban model and come and try.
Before we come to, but in the meantime, if we took these people to Cuba to go and study or to go and, of course, benchmark, we need to ask ourselves also critical questions, because the government also, we know, had embarked on a program of equipping these hospitals in the counties in the first place.
And some of the equipment is lying idle because there are no personnel to run
it. They are lying idle, first of all, right? So that also brings the need to actually have imported doctors into the country to operate this equipment. We know some of them are still in the stores. We don't have the right personnel to operate them. Secondly, the question...
100 won't do it.
100 would do it, but at least it's a start. Yeah, then another question. A solution. Just a moment. Then, of course, how many oncologists do we have in this country? Right now,
I don't think there are more than 10.
They're not even more. Actually, they're not even more than I think 12. We have 12 oncologists in the country. Yes. If you say, because we don't know actually the figures or the speciality of these doctors who are coming. We do not know if they're oncologists or whatever field they might be, or it should be their bias. So if we have even 20 more oncologists Wouldn't that be a good thing?
Yeah,
Absolutely.
that would be a good thing.
That would be a good
Even
thing.
if
So
it's
does
a
it
short-term measure.
But we
Yeah.
need to train our people.
Can I speak to this?
We need to train them.
Before,
All right.
because I'm responding partly to you. I think we must distinguish between the healthcare system and the medical personnel. Everything I heard my friend Jakoyo and Senator Matangi speaks to the healthcare system, not so much the medical personnel. I think we must agree that actually in this country, Kenya has produced some of the best doctors who have actually ended up migrating and do very well in other countries. So it can't be that we don't have the training and the capacity. When it comes to healthcare system, it's not so much about the medical personnel, it's the administration. So when we say the healthcare system in Cuba works, it means the administrators and the administration of the system works. Now that administration will not be solved by bringing 100 doctors. It will be solved by examining our own individual situation. Everything Jacob Midio says is true. I also come from Siaya. But will any one of these doctors go to Siaya? The answer is still no. So how will it help? What we must look at the healthcare system. We must look at the misuse of funds. As we speak, there are, I think, 100 containers still lying somewhere in Mombasa, which were bought at a cost of, was it 130 million each?
No, it was
More than that. Will the doctors help us now bring those so-called mobile clinics to work? It will not. As we speak, we have doctors who are leaving most counties. Most counties, not just Siaya. Most counties are now without actually doctors because you have a situation where the government decided to devolve the entirety of the healthcare system. That's not what the Constitution demands. Under the Constitution, it's shared. But they decided to devolve all of it. Then money is given to the counties. But because county governors and county administrators want to put money in things where they can get some balances, paying personnel, especially doctors, is not one of them. So they don't prioritize. And the result is that the doctors now leave and come into private practice. That's what we need to examine. Do we need to now say the idea of devolving the entirety of the healthcare system is not wise? Let it be shared as contemplated in the Constitution. These are conversations we need to have by ourselves, not necessarily by bringing 100 doctors from Cuba.
All right.
Let me just put a last word on this one. And to say this, I think that the issue of the administration of healthcare is one. And it is true that we have got very serious shortcomings. In fact, I'll even go further than my brother to say that a lot of what you see in hospitals is because of vendor-driven supply into hospitals. In other words, rather than the doctors themselves and the patients and the administrators of the hospitals wanting something, you know, what is coming to them is not necessarily what they have requested. It is something that is vendor-driven for obvious reasons, and I need not go much into that. I agree, but let us not mix issues here. I think the idea of getting doctors, is not supposed to be a panacea, you know, of all the problems that exist in our healthcare. This is a measure, is a short-term measure to fill a gap even as you wait to do all the things that my brothers are suggesting that we do. And we should do them. I am in total agreement. The fact that 100 doctors are coming here, in fact, is a starting process of what Dr. Eseli is saying. Let us study the Cuban health system. Let's even have some of the doctors here who can even help us understand it on base better than you probably understand it when we are there. So for me, it's a question of why are we doing all these things? Because there is a person who is unwell, who needs treatment. Never mind all the debates. Somebody is unwell in Siaya, somebody is unwell in Nyeri, that person needs treatment. Not tomorrow, not when you solve your problems, but right now. So if I have got cancer, and there are 10 doctors in Kenya who can treat me, and suddenly there are 40, there can be one in Siaya, one in Nyeri, one in the other county, then it helps me a great deal. So debate all you want, but give me a doctor to treat me as a Kenyan. And I think that's what the government is trying to do right now.
All right.
Yeah, but I also, Debarl, I think something needs to be very clear so we don't confuse our viewers. The government, the national government, is in charge of referral hospitals, and there aren't too many.
Yeah, level 5.
Yeah, when I'm looking at yesterday's standard, where health workers own up to mistreating patients. In fact, they are saying, they are admitting they have bad attitude. They are also admitting they have put money over treating patients. It's all in yesterday's paper. Now, if you can have the Chinese driving trains on SGR, it's no African. Even somebody told me yesterday, saw a Chinese sweeping in one of the stations. Why can't we bring qualified doctors to whoever is bringing all these Chinese people here? Why can't they bring us doctors from Cuba so our people can stop dying? And then we debate. The thing is, when they admit, like when you say train our people, or we talk about the health system, the doctors who operated wrongly not too long ago on a patient, that kind of incompetence, if you did it in another country, those doctors would be in prison. They don't value human life. And this is the only place I know where you go to hospital, you are not given medicine, and if you die, you still pay. This thing is a very big problem. In fact, these politicians here will tell you a week hardly ever passes without contribution being asked of them for somebody to go to India. If we can even hand over Kenyatta National Hospital to Cuba government and do it their way, and our people stop dying, I mean, we would have gone so many steps.
Thank you.
Yeah.
Right. Senator Mwatangi, briefly?
Yes,
very briefly.
Debarl, it's my belief that every effort must be put by all of us to ensure that that we can bring solutions to the table about our health care. As Dr. Otienda Molo says, the healthcare system itself in its entirety, whether it is administrative, whether it is in practice, whether the practitioners, the fact remains the same, that if you go to any part of this country and ask any Kenyan, are you satisfied? Are you happy? Do you access medical health care as you should? Have you, in the recent past, maybe in the last 2 months, witnessed anyone in your family or friends or village die because they could not be able to get proper medical health care? The answer will always be a resounding yes. And as long as that is the answer you have from Kenyans, then you must do something. You must do something. Whether you bring them by boat, whether you bring them by air, whether you bring 100 or 1 million, but something must start to happen. And that answer must remain, as we've said. Let us focus on getting our own people trained as we facilitate them.
Thank you.
That should be
and of course, this is a nagging question that I've been asking myself. If you, Dr. Eseli, as a doctor, you've taken that Hippocratic oath that you will protect life, how then do you go full steam ahead as a doctor to strike and, you leave hospitals where people are dying, and yet you've taken an oath to protect the same very life? Isn't that really flies?
These doctors do have families. They have children that go to school. They need to pay fees. They have dependents.
No. But
no.
The question is,
wait a minute.
You've taken a Hippocratic oath. What is the reason for you taking the Hippocratic oath?
The Hippocratic oath should not be held against the doctors so that you can either pay them, mishandle them, do whatever you want to them because they have got the Hippocratic oath.
If you take this oath, why do you take this oath?
The thing is this, it is very painful when you are working in a hospital and you know that I should do this for this patient, but you don't have the equipment or the facility to do that for that patient. At the same time, when it's like what Jacoy has just said, you do something, it goes wrong, something goes wrong with the work that maybe a patient you are seeing and something went wrong, you will be blamed. Okay? So you are holding a lot of responsibility with that Hippocratic oath. But it should not be used as a shield to hurt the doctors. Because really, it is sad. Doctors are living in servants' quarters. Who is living in the main house?
But your burden of cautions does not really get affected when you actually on the street and people are dying in hospital.
Why are you allowing these doctors to live in servants' quarters?
All right, let's leave it at that. No, let's just leave it at that.